Now that Florida has become the first state to have a local transmission, likely through a mosquito, we will continue to put every resource available to fighting the spread of Zika in our state. It's become clear, if it becomes clear more resources are needed, we will not hesitate. Following today's news, I am directing the Department of Health to immediately begin contracting with commercial pest control companies to increase spraying and mosquito abatement efforts in the impacted area.
Governor Rick Scott of Florida on Friday talking about Zika in his state, and now we just got a new headline just moments ago with the governor announcing that there's at least 10 more cases, so bringing the total number to 14 people who have contracted the virus, apparently from local mosquito bites in America. Dr. Manny Alvarez is senior managing editor at FoxNewsHealth.com, part of our medical aid team. I say in America because the previous cases have been from travel or other situations, right, and not necessarily from getting a bite here in the United States.
Right. I mean, we have over 1,000 cases of people that have traveled, and gotten infected in other countries. We have a couple of cases brewing where we don't know exactly how they got Zika. A healthcare worker, for instance, in the middle of the country got exposed, and we don't know those types of transmissions yet. So the bulk has been either sexual contact or people traveling abroad.
Are you telling your patients not to go to Florida now?
Good question. Look, right now, Florida, and it's not going to be Florida, it's going to be a lot of the states down south are going to maybe see cases of Zika because this is the mosquito season, the rain season is coming upon us. So we're going to see this happening more and more. If you don't have any travel plans to go to Florida, don't do it, especially if you're pregnant. If you have already the plans, don't cancel them, but be aware that you have to be very careful about mosquito bites.
There's still so much we don't know about Zika. How long it stays in the system, for example, how afraid we really all need to be, even if we're not pregnant at this time. How do you see it?
Look, as a high-risk obstetrician, and we've been publishing a lot on this in our own hospital, we are learning every day how problematic this virus is for pregnant women at all stages. In the beginning, in the first trimester or so, if you get infected, you may end up with microcephaly, which is that anatomical deformity of the brain, and that's a lethal, problematic thing for the newborn. We're also seeing cases, and we're looking at the data, where babies have been exposed in utero, did not get microcephaly, but now are showing signs of seizures disorders. So this is a virus that has a high affinity for placental tissue, has a high affinity for the neural tissue in the newborn, and it's going to create a lot of problems.
And that would be a shift, even in the time that I was pregnant, right, which was just a few months ago, till now. The warning for pregnant women was really at the very beginning of your pregnancy, but you're saying at this point there's still a warning in general.
We'll learn every day. We're learning new things about the virus.
When you go to the drugstore and you look at the mosquito repellent section, I mean, there's so many different mosquito repellents out there. How effective is repellent? What would you recommend to families?
Repellent are effective maybe for an hour. They're all good. They usually have all the same chemicals. If you want to learn more, you go to Fox News Health. We have good articles about which lotion to get. But look, at the end of the day, you have to put it repeatedly. You have to fumigate your home. You have to make sure that you follow instructions. And if you can, if you live in South Florida and you can afford, I would get a private exterminator to go and create a plan, especially for the next 2 or 3 months, to eradicate your mosquitoes.
The governor's asking for federal dollars.
Oh my God! Listen, this is something that Congress should have really paid attention. I think that they should have passed legislation to kind of beef up the dollars that they need for vaccine research, because this is the only way to fight this problem. I personally, the president put an Ebola SAR back in the day. I think you need some sort of federal regulator now to take charge of what's going on in the states, because a lot of communities do not have the resources to eradicate mosquitoes.
Well, as you point out, the mosquito that carries this virus is found in the southern part of the United States, not just in Florida.
Yeah, it's two types of mosquitoes in particular. They're both related. They're first cousins, if you will, but they do have a vast geographical exposure.
Before I let you go, so now we were at 4. A few days later, now we're at 14 cases. At what point do you say, this is over the tipping point of cases to where I'm not sure we're going to be able to get ahead of this? Are you already at that point?
I think we are. I think we are a little bit over the tipping point, and this is time now to really put concentrations in finding vaccines, put concentrations in putting resources. Don't waste resources, because that's what happened in Ebola. They put money, but they didn't really solve anything.
Quick final question as well for families. What about your children, young kids that you have, of course, already would everybody get the vaccine, parents and children, or would it just be focused on pregnant
I mean, look,
women?
it's too early to tell exactly how the vaccine is going to be, tested and distributed, but this is something that we have to pay attention to.
Dr. Manny, great to see you as always. We'll be watching this.